Alright, so this is our case number 1. In this case, as you can see, this is a 50-year-old Malay gentleman with underlying ischemic heart disease, diabetes mellitus, as well as hypertension, presented to our emergency department with complaint of central chest pain for 1 hour duration. It was crushing in nature and associated with profuse sweating, SOB, and also palpitation. Upon arrival at your emergency department, a 12-lead ECG was done. So this is the ECG, right? You can have a look at the ECG, right? So the findings on that particular ECG, as you can see, there is an obvious ST elevations at inferior leads, which are our lead number 2, lead number 3, as well as lead AVF. And you can also see the reciprocal ST depression at lateral leads, namely our lead number 1, as well as AVL. And there is also associated ST depression at lead number V1 until V4. So the diagnosis in this case, considering the symptom and the ECG, is acute inferior myocardial infarction, or as we also refer to as a acute inferior STEMI. So what are examples of other ECGs in acute myocardial infarction and also STEMI? So this is the example of ECG in anterior STEMI. As you can see, we can see obvious ST elevation from lead V1 until V6. And there is also ST depression, what we call as a reciprocal ST depression at inferior leads, which are our lead 2, 3, and also AVF. This is another example of lateral STEMI. As you can see, there is obvious ST elevation at lead 1 and also lead AVL, with also hyperacuity seen at another lateral leads, which are our lead V4 until V6. There is also a reciprocal ST depression at inferior leads, which are our lead 2, 3, and also AVF. Right, so what are the key ECG findings in acute myocardial infarction? Alright, you can see ST segment elevation in 2 or more contiguous leads. By definition, it should be at least 1 mm from your J point, except in lead V2 and also V3. And we also expect to see some ST depression at the opposite leads. For example, if you have a ST elevation at lateral leads, you are expected to see ST depression at the inferior leads. Same goes for inferior MI. If you have a ST elevation at inferior leads, you are expected to see what we call as a reciprocal ST depression at lateral leads. And in the case of acute myocardial infarction as well, we are expected to see what we call as a dynamic ECG changes, meaning that from your first ECG to your second ECG and to your third ECG, you may see some of the dynamic or worsening of the ST elevation. So this is just a recap, okay, on what are the territories for each lead. As you can see in the slide, for inferior surface, okay, the leads are represented by lead number 2, 3, and AVF. For anterior surface, it was our lead V1 until V4. For lateral surface, is lead 1, AVL, V5, and V6. And for right atrium or cavity of left ventricle, each lead 1, V1, and also AVR. So depending on your area of infarct, you are expected to see ST elevation at these respective leads. So that concludes our case number 1.